All right, well, thank you everyone for coming today. Today we're going to be speaking about cybersecurity in healthcare, kind of a high level. I'm not sure what all you guys do, but generally we just want to start at the high level and just make sure that everyone kind of has the idea of just best practices, what you would do. I do have to start off and say, I'm really proud of you guys. Training number 1, you passed. So nobody besides Brian Mays wrote their name and their password on this form over there by the computer. So you would be surprised how many people will actually fall into little social engineered type scenarios like that. So same thing as somebody giving you, that's really buzzing. That's me.
Somehow we're getting feedback.
Okay. Yeah, you'd be surprised how many people actually would give you their username and password just inadvertently, not even thinking about it. So without further ado, today we're going to talk in more of like a game style. So I don't know if anybody's ever seen the game show Press Your Luck. So premise of the game, basically you push a button, number spinning, you either get a good or a bad. And generally that's kind of the way it works in cybersecurity, especially in healthcare. You want to be good, you never want to be bad, but there are scenarios that always happen. And so we're just going to kind of run through some scenarios like that today as we talk. So Dustin, you want to go ahead and talk a little bit?
Well, a little bit about us. So I've been in the HCM side for 30 some odd years, and I'm sorry about the feedback. I'm keeping my mics on, and hopefully the MD Expo folks will hear this. I just don't know because they're recording it, right? If it feeds right into the computer. But I've worked for ECRI for only about a year. I joined ECRI because I've used a lot of the services over the years, and because it was kind of the next step in what I wanted to do with my career. But at my truest nature, I'm still a wrench turner, right? I'm a generalist in this sense, even though you might have heard me talking to Dan here, who I've known for a while, about some of the specialty stuff that I've done. But I like to kind of dabble in a lot of different things. So if you want to connect sometime, we can talk about lots of different things. In the case of Scott, I'm going to do a little introduction to Scott, but he's going to finish up. Scott's our cybersecurity lead for ECRI. He has, and I'll just pass it over to him.
Okay. Yeah, I've been in the IT industry for over 22 years. Most all of it's been in healthcare. Started out writing software for radiation oncology. Then I worked for the University of Oklahoma for several years doing cybersecurity systems administration, things like that. So most of my experience has always been in and around healthcare. So I just have a heart for technology and a heart for people. So that's kind of how I've just kind of worked my way through the years. So a little bit about ECRI, which most, I don't know most, but a lot of people from what I've noticed the last few days. So I've been in ECRI for about 9 months. And I've noticed just since I've been here, just about everybody knows who ECRI is, but they're an independent nonprofit. They've been in business over 50 years. We work through evidence-based guidance for healthcare technology, and then we do cybersecurity expertise for medical device management. So basically, we're like what was it you said yesterday, that the good analogy for what ECRI is?
Well, one thing that I remember early on is consumer reports for medical devices. We do a lot more than that, but if you think about those comparisons about which vacuum's better, if you've seen those, right? It's not as common. We still do that for medical devices, and it was really useful, and it's always been useful for me to look at the apples and see which one stands out for the features that maybe my healthcare system needs or wants, right? Needs usually outweigh the wants.
So today's game rules. Obviously, the objective is to learn something new on cybersecurity through gameplay. We're going to show some real world scenarios. I've changed names except for Steve because Steve does everything wrong. Volunteers, you can select, we kind of made this up, but you can then select your squares, reveal your whammies, and we'll talk about each scenario. Definitely no wrong answers, and definitely this is going to be a participation. So definitely we'd like to banter back and forth with you guys.
So instead of the squares, what we did to gamify this a little bit, we've got these buttons. So if you're like me, don't press these buttons until you want to answer something. They're a little sensitive, but I'm going to put them around the room. you take one. Just be careful, be careful. Some of them are deliberately whammies, if you will. Some of them are just a little bit of fun around cybersecurity. I've got one more I'll pass around the room. If you guys want them or whatever, steal them away from somebody. But what we want to do is make sure that you have an opportunity to kind of say, talk through these scenarios with us. I got one more I think I need to give out.
Nice.
And we do have some prizes, right? So go ahead, Scott, sorry.
Yep. So the main thing that we kind of, the buzzword that you'll hear now for an organization is, what is your security posture? Basically, what have you implemented in your security stack that's protecting your employees, your data, your facility, and what goes into behind it to help guide that, so your policies. So the NIST definition of cybersecurity posture is the security status of an enterprise networks, information, and systems based on information security resources, capabilities in place to manage, defense, and react as situations change. So there are 4 pillars of the healthcare security posture. You got people, which includes all your staff, even down to your cleaning crew, everything like that. And that big category, we do a lot of training and awareness, which I'm sure most people have either had a phish email test or your annual cybersecurity training. All that falls underneath that. You've got hardware, which is your physical security, so your actual jacks in the wall, things like that, computers, different things like that, your wireless connectivity that's up in the ceiling, those are all considered pieces of hardware. Additionally, you got your badge readers, so when you're clocking in, you clock in, then you swipe your badge and you go through the door. And then you have software, which, everything you have nowadays runs software. You probably get prompted every 2 days for a new update. That's one of the things you want to do, because vulnerabilities are found, fixes are pushed out, and so you just want to keep your systems as updated as possible. And then finally, we have policies, which are just the clear guidelines and procedures of what you would do best to have a good security posture.
So, yeah, I'm gonna talk about those things that are more tangible to me as an HCM professional, who I can tell you I went through the DoD or the US Army at the time, biomed school, and we had an element of microprocessors as far as our training, but it was really, really basic, right? So basic that it was really easy for me to pass, because as a nerd back in the 80s, right, I already had more knowledge about what we looked at. But people are something that I can talk about a little bit because of that, right? I can tell you that one of the most frontline pillars, as we talked about, but most frontline pillars for strengthening your security posture is people. From an HCM perspective, people are important because you need to look and see what, say, your clinical staff claims they need access to in an emergency, right? They may say that they need to avoid putting in a login or avoid a password because they're working in the emergency room. Your people, right? If you are the technician, if you are the director or manager or whatever, can help kind of navigate the people element in thinking, look, do you really need, right, to do that in relationship to the risk that it might pose for a device that's, say, open? And you're going to talk a little bit about passwords, but I'm going to say this. I worked at the children's hospital. I've actually worked at a couple of children's hospitals. And I found it interesting that radiology, one day with the children's hospital that I was actually interviewing with and eventually worked at, radiology had, obviously, they had a password of 1234 on their portable x-ray unit. Well, that's probably maybe it's me, old school, but that's how I learned sometimes how to play around with the phones when they were push buttons, is I just go 1, 2, 3, 4. Pretty easy password for somebody to figure out. But if it's a bad actor, it's an even easier password to figure out, because it's either 1111 or zeros, or maybe nines, and then 1, 2, 3, 4. At least that's my process for going through this. So we've mentioned a couple of things here, and we're going to go a little bit in depth. And you can see here phishing. Does anybody not know what phishing is? So phishing is an email, and nobody said no, they don't. But does everybody know what smishing is? Have you heard the smishing? Great. No? Maybe? Or you're just kind of, okay, the SMS. So the text messaging, I will tell you very honestly, it was only after attending all these different virtual, at least annual trainings on cybersecurity, I didn't hear smishing until, I don't know, 3 years ago, right? Because it wasn't an emphasis, at least. It was important, but it was much more important, and you'll see that it's actually much more important on the email. Where this affects biomeds is I can tell you, we could probably call up a biomed department right now, and I could say, I am with so-and-so, and I can talk the talk, right? Just enough to sound like I work for X, Y, or Z company, and say, I need the password to get into this. This is one of those socially engineered kind of constructs. Now, we add something in here called AI, right? And it can go another layer. Why this matters as far as security and devices is because that first layer of defense, the people might be your problem, right? They may just innocently say, hey, I'm going to give you access to this. I certainly have seen some systems that it's a little too easy to get into by just simply asking the local biomed department, hey, I'm a biomed too, I need the access to it as a contractor, vendor, or even posing as that. So, first game. Now, I'm gonna go through a little a scenario, and I'm gonna ask you, kind of based on the scenario, it's kind of leading, right? You can tell, but I'm gonna ask you kind of what the wins might be if done well, and what the whammies might be in the pressure luck style. So, Steve, although you said Steve is never a bad actor, Steve, unintentionally, right, responds to an email from Robert, not unintentionally, but he sees a message from Robert with IT saying he's with IT help desk support from HealthCo, company that Steve works for too, right? We made that up. I don't know that there's a true HealthCo, but they both work for the same company. Robert's email explains there's an emergency update that needs to be performed, right, on Steve's system. Can he get Steve's login credentials because they don't seem to be working for Robert, his admin rights or whatever. Sends him a secure link. I know we shouldn't have put that in quotes because maybe that's a giveaway. He sends him a secure link and says, you know, please just give me those credentials over this secure link, right? And then I'll be able to log in and perform the work that I need to do right now. What should Steve have done, or what do you think Steve did? And again, now's one of those times where if you want to press the whammy button, or you want to raise a hand, maybe you don't want to press the button. And I say whammy, they're not all whammies. But if you want to press the button, make a noise, or raise your hand, what do you think Steve should have done? Or did do in this case? Well, I'm going to move on. Oh, there you go.
I think Steve, he should have called his IT department and asked to speak to whoever he got that email from, just to see if he is physically a person who works for that IT department. If they're both work for the same company, then you should have the phone number for, like most departments in a hospital. I've seen they have the phone number for IT right there. Oh, I got this email from Steve in your department, you know, and if they say there's no Steve working here, then you know. I mean, but see, that's you try to verify that email is from someone and is a legitimate email.
I like it sort of. Dan and I have known each other for a while, so I hope he knows that I respect him quite a bit. I like it sort of. But what if they say, yeah, there's a Steve that works here, right? And you're talking to Mike, or you're talking to Scott.
Can I talk to that? If they say there's Steve working, I'd say, can I talk to that Steve?
Maybe, because at least then you can ask Steve, did you send this email, right? That's kind of where, but I see something better. Right? don't trust the website. This is a good identifier. Now, I know we've got some verbose language in here, but look at this. It actually says fakehealthco.org. Most companies aren't going to say fake whatever, fake Intermountain Healthcare. I used to work for them, fake ECRI. If you see that, that's probably a dead giveaway. But let's move on and let's see what the whammy was at least. So Steve did fall victim to a targeted social engineering attack. The social engineering is there's a sense of urgency. I work for the same company. I need to do this work and I need to do it now. But the company, right? I work for the same company, like you were saying, but I don't know who Robert is, I should say. But Robert with IT identifies himself as a brother in arms, right? At least in the healthcare organization. He also could have noticed that Robert had helpdesk@gmail.com, right? Now, although Google does provide workspaces, you will never probably see a company who uses Google Workspaces actually use an @gmail.com. I say never probably, but there are a few probably that can and do. They'll use their own domain name for that. So if Steve, we're talking about this, if Steve had remembered really, let's say we assume that he had been provided comprehensive training. If he had remembered that training, right, he may have thought differently. And it sounds like you've been trained. All of you kind of said, yeah, I've gone through some training recently. But it's remembering those key points, right? Don't just click through the training. Scott knows, because when we were developing this, I said, boy, it's good to have training that you actually have to pause on and think, as opposed to the ones that you can test out of. That's my opinion. Because those test outs are a little easier. The big win could have been, right? Let's say the scenario had been turned. Steve remembered what he learned, right? And he focused on the communication safety. It highlighted phishing, smishing, and social engineering. Steve receives the email in this situation, same situation, but he responds to it differently. And he notices right away that Robert is asking for his user credentials. Never give away your own user credentials, even if you know the person, right? We actually had a little glitch before most of you got in this room. And I was joking about, hey, I'm going to put my credentials on this laptop and then forget to put them on or take them off, because we were going to download the presentation again, right? Fortunately, we didn't have to do that thanks to the MD Expo folks. But security training gave Steve kind of a leg up. The point is that people can be that front line of defense, right? But I'm going to turn it over to Scott to talk about some of those things that are a little bit more technical.
Yeah, so the hardware component, it spans, physical security, network security, things like that. So the actual physical switches, things like that. When you think about your building and how everything is managed and placed, you always want to make sure that your equipment is not accessible to just anyone walking down the hallway. In a previous life, I had a managed service company, and so I had a bunch of clients, and I would go to their facilities. And if I was picking up a new client, the first thing I would do is I'd kind of walk around and see how, if they had a server, where's it at, in your building. So, okay, cool. So you have a closet where everything goes, and you have your network rack and everything. Problem is it's right next to the front door and there's no lock on it. And they were a small doctor's office. So that was, red flag number one. So we had the conversation of like, well, this is great. Your setup's good, but you need to put a lock on this door yesterday, because that system could walk out, and we all know how much a PHI data breach can cost individuals, companies, organizations. Along with that, as you go to work every day, everybody has a badge. You clock in, you badge in and get through the door. And on top of that, when you're in your area, you're going to have your medical devices. You got all your carts, your things like that, your ultrasounds, the mobile X-rays. Things like that are generally locked, not logged in, things like that. Environmental protection. So you also have your fire suppression and your flood. Additional security systems that they have. When you talk about your network systems, you have your you're always encrypting your data as it's going across the network. That's tied to the hardware. It's more of, part of the software, but it is related. You're using your network hardware to segment your VLANs. Your equipment is going to be able to detect intrusion, having redundant hardware for uptime, and then also working with your legacy devices. So if you had, legacy devices on your network, you need to secure those as well. And a lot of times that would be segmentation and things like that. So when we're going to look at today's hardware scenario, Pat, who is our bad actor today, he tailgated. Does everybody know what the word tailgate means? So when you clock in and,
Oh, sorry.
well, yeah, once you're drunk. No.
Yeah.
No,
What you do at a football game.
Yeah.
Or before and after.
So there's tailgating. So another past life that I had, I actually did physical social engineering. And so we would actually they would hire us to go to, let's say, Intermountain Medical. I'd walk in, I'd have a jumpsuit on, I'd have a ladder, and I tell them I'm Steve with the IT department and I need access to your network closet. Susan says, okay, cool, lets them right in. So that was one of those things that you got to look for. In this particular instance, we've got Pat, who is the bad actor, and he's going to tailgate an employee that's going back into the secure area. That bad actor then once through, kind of hangs out for a minute, and then finds that he sees a mobile ultrasound cart. That cart was just recently used, and it was still logged in, and the bad actor was able to plug in his thumb drive and extract some sensitive patient data. What do you think in that scenario? This one's a little bit different than the first one. So we have multiple things going on here. So we can start with the tailgating. We can start with, the ultrasound and so forth. So does anybody have any ideas how to make a win in this situation?
We didn't hear that. Shall we play a game from War Games? Anyway.
Yeah, I mean,
Yeah,
that's a great one. So yeah, in this scenario, you have a couple of things. So going through the door, you may not necessarily have like a receptionist or somebody sitting right there by the door. So it's pretty easy in some areas for people to slip through. But once you're in the area, generally, people walking around are going to have scrubs or things like that. In this particular instance, I'm not sure what Pat's wearing, but there's a good chance he may have gone and bought a pair of scrubs and then made that a little bit easier way to get in there. On this one, what I would have done, and I guess let's look at the WAMI really quick. So Pat, the bad actor, actually was able to physically access the medical device, and due to multiple misconfigurations on the device did not have a screen timeout enabled, so it was still logged in. So first off, the person, make it a good habit to, Windows L or just log out, when you're done, just as same thing as your workstation, when you walk away. But most systems, if you forget, you're going to have like a 2-minute timeout. So you've got 2 minutes that you may be exposed, but I would rather have 2 minutes of exposure than an hour of exposure. So making sure your devices are configured to where they would time out if no exit or no activity has been detected. And then on top of that, you had the USB port. So one of the things that you want to do if you have a medical device and there's any sort of communication port, whether it's a USB or serial or wireless or a network card, if you're not using it, turn it off. And if it doesn't have the ability to turn off, you definitely want to talk to the manufacturer about that, because that should be something. Yes, sir.
Sometimes you can just disable the USB because sometimes when the diagram goes down, you have to export.
Sure. And in a scenario like that, yeah.
It's not a good bet. But some people say that you have to just put like a patient identification, not more. That's how you communicate. I mean, do not fill like patient info, complete patient. Just use the identification. This identification is just like communication between you and someone.
Sure. Yeah, like the unique identifier to pass it over to the PACS, and then therefore it would go into Epic or your EMR from there. Yeah, and that's a good point. Now, as a cybersecurity professional that's been doing it a long time, I don't care. you're going to have that USB turned off because USB is one of the fastest ways to steal data.
Case if you might need access to the USB, use a port blocker.
You do that?
USB port blockers.
Yeah.
Yeah, physical port blocker. We did that at one organization on a lot of our devices, and it really made us feel a lot more secure. When our biomed techs went out to do PMs on those same devices, we never saw them disengaged. There are some tricks on almost all those, but it's a good practice. One of the reasons you should question, I believe, you should question whether or not that USB needs, or the USB port needs access, is because of the security measures. But why do you need access? I understand that DICOM can go down, but if your organization is so dependent on that DICOM exchange going down and that device, what are you going to do if you have a USB? The USB is going to be plugged in, then you're going to have to run to a workstation, right? Now, I know a lot of, I've worked in academic facilities, and the VAs are also academic facilities, and sometimes doctors have come to me and said, well, I really need to be able to hold this study that I have approval to demonstrate at a conference like this. They can go back, usually if you have DICOM export on, they can go back to a workstation that's more secure in a secure area, hopefully that somebody hasn't tailgated into, right? And then put it on media, maybe it's USB or a CD or whatever.
Is it recommended to turn off all USB devices in one radiology?
No. I absolutely believe, and correct me if I'm wrong, I think you need to do a risk assessment about, is there a need for you to have that USB port? I'm giving you some examples of, ask the question, why do you need that open, right? If you can secure it in some way, right? You can physically disable it, right? Disconnect it from the back end, you can put a port blocker on, or you can software disable it. Then you probably should, if there's no good reason to have immediate access to it. Now, I'm familiar with most of the ultrasound systems that are out there right now, and I don't believe there's a way to do role-based access, unfortunately. So you couldn't say have the doctor who has a login that then takes another step to say, I'm going to log in so that I can have that USB enabled. You're going to have to figure out if you disable it, block it, whatever, or if there is a need to actually have it open, and then figure out another way around it. One thing we did with the blockers, by the way, is we gave key people access to those ports, or we gave them the keys, right? The little dongle for the port blockers. We usually reserve that to, in imaging, we reserve that to the imaging coordinator, right? Because the director didn't want to have that full-time responsibility. And then on the nursing floors, we debated this and we did it, but nobody said they ever used it, right? As the nursing directors or managers had those. So they could make that active decision. It's just one layer before you get into this. But think about this. Yeah, you're absolutely right. There are some situations that you don't want to disable. And one other thing is some technology operates off of those USB ports. So if you're going to disable USB ports, right, software disable or OS disable, is that the right term, Scott? If you're going to go in and disable it, make sure you're not disabling communication to something else, right? There's some X-ray systems out there that use USB to connect to this, and then there's a USB port in the front. Make sure you're disconnecting the USB
Yeah, it's
port.
definitely a case-by-case scenario or device, by device scenario, depending, because some devices don't have that capability either. So then you just have to make extra measures. So let's say you do have a device that the USB is on, you want it always to be, secured, whatever. That would be one of those. Absolutely make sure it logs off, because it doesn't matter if you throw a USB in. More than likely, it's not going to be a problem. So just taking your alternative measures if you can't disable, or it's just a situation where you need it on from time to time. So that makes good sense.
I said we had some prizes. I forgot to get a handful of these things out and had a couple people answer. Go ahead, Scott.
Yep. So in the big win,
Smarties. There you go. Sorry.
so Pat, the bad actor, was able to physically access the area,
Sticker.
but luckily the device was secured by your IT department and your IT security team, and Pat wasn't able to access anything. So the proper configurations, kind of like we talked about 2 minutes ago, the 2-minute screen timeout, USB ports were disabled, the encryption was able on the hard drive. So if someone was to take the device itself, take it apart, the hard drive wouldn't be able to be read. And then there was also a physical lock on the cart and the device when not in use. So the next key component that we're going to look at as the pillars is your software. So, everybody downloads, your updates, things like that. You got all your apps on your phone constantly being prompted for updates. Honestly, so when you look at your digital asset protections, one of the things, and this is really more geared, and biomeds would probably be interested in it because you guys may help with doing updates and things like that on your medical devices. But a lot of this is going to happen with your IT team or your cybersecurity team or a joint of the two. So you'll have your teams are going to be doing regularly patching. So all your workstations, your workstation at work, occasionally you'll come in the next day and it's been rebooted overnight. Somebody pushed out updates for you and rebooted it. There are vulnerability assessments that are done. Most of the time when I was a security engineer, we had bi-weekly vulnerability meetings. And basically what we would do is we would pull up our Tenable console, and it hits every single computer in our system. And it will tell us any of those that have vulnerabilities. So like, the log4j that was out for anything running Apache on there. Lots of Windows updates are constantly out there. Mac updates are out there. So we would bi-weekly go through and we'd have these meetings with cybersecurity, and then we would have it with our IT team. And basically the IT team would do the work and do the patching and the updates, and then we would basically review and just make sure it was done. And if not, escalate it, ask why, figure out, and then just make sure things were patched. And then on top of that, you have your legacy system management. So if everyone's aware of, legacy systems, they're basically the NIST definition is a system that can no longer be updated or supported by the manufacturer. Whether that's something that's 20 years old or 2 weeks old, if there's not a way to update that system, if there was a vulnerability, that becomes legacy category.
Scott, could you, because I like legacy, but it's also vague. It sounds like it's old.
Yeah.
You mentioned the 2 weeks thing. What's a case where something you just bought can be unpatchable?
So that's a good question. So the iPhone 17 came out, and I believe there was an issue within like the first few days. They didn't have a patch because there was a problem on the phone. During those first few days, you're kind of in limbo. And so unfortunately that happens a lot. Cell phones are a big one, probably laptop. I mean, any operating system could be in that scenario. But for probably 2 or 3 days, the iPhone 17 might have been in legacy status. So just something like that.
What about those like MMS modules? Anybody have Philips monitors? They have firmware in them, and maybe that's not the best example. What if it's a patient monitor that actually has Windows really beneath?
Oh, like
everything?
a Windows kernel underneath
Right,
it?
but it's what's the term? Well, I'm blanking right now. It's an embedded OS.
Yeah.
Right.
The XDS.
The XDS. Okay.
Windows OS.
So those are what I'm thinking too, as more applicable probably to this group is they are, I mean, some of you may have the iPhone 17, you might want to get the update apparently, but those are the types of things too that fall under legacy, something that you just can't do anything with it after you just bought it 2 weeks
If
ago.
you can't patch it, yeah.
Yeah.
So really that kind of
or you can't do anything with the device, the operating system.
Yeah. So when you're in a scenario like that and you can't protect your device because it can't be updated, then you have to get in there and do some of the other mitigating procedures. So you definitely keep it locked down. That's kind of where you circle back into a physical security scenario. Or when it's on your network, if it's network connected, you have a VLAN, it doesn't ever see outside, doesn't connect to the internet, things like that. So you just have to protect those systems as much as possible from the outside. Under data security, email, and these are all buzzwords that you've probably heard. Encryption at rest is the data on your actual hard drives. So like on your laptop or your phone or anything like that, that's considered what is data at rest. So you want that hard, and I guarantee you all of your IT departments, before they issue a computer to you, they have encrypted your internal hard drive. And if not, this is 2025 and that's really bad on them. Encryption in transit or in motion is data over the network. So everything should be encrypted from A to B. When you go to a URL and it has the little lock up there, it's showing you that your traffic is encrypted. If you go to a website that doesn't have that, it'll have a little yellow triangle and tell you, hey, this is an unsecure site. Do you still want to go? And they'll let you, but your data is plain text at that point. And so if you're going to go log in and you're going to put your username and your password in, it's going to be plain text. So you definitely don't want to do that. And then on top of that, you've got your access controls and least privilege. So the idea behind it, and you kind of talked about it earlier, role-based access control. So what that means is basically any system that allows you to granular access privilege, you want to do it as much as possible. So if you're a standard user, I'm a power user, you log in, I log in, or you can be the power user.
Okay,
Don't cry,
okay.
Dustin, that's okay. So with the administrative levels, you can go in there and you have the access and ability to turn on and off your USB ports. I'm just a user, so I don't. So when I log in, I don't even see those menus. So that's kind of what access control and least privilege is. One thing that a lot of places do right and a lot of places don't do right is data classification and labeling. So when your data is in store on your hard drive or your back end, you know, everybody uses cloud these days. It's really important that you actually categorize your data and label it as much as possible, because so there's cybersecurity tools out there like DSPM, data security posture management. And what that does is that will actually go in there, and DLP, different things like that. Those will actually go in and can actually read your contents and tell you this has PHI, this has PII, this has PCI, this has different kinds of sensitive data in it, and it'll categorize it automatically. So having a system like that in your environment kind of helps minimize, you know, the risk of data sneaking out that you didn't know was in a folder that it shouldn't have been. Cloud security posture management, SaaS security posture management, those are some new things that are in the last couple of years. I spent a lot of time working on SaaS security posture management at my previous employer. And basically what I did was I managed the 45 different cloud solutions that we had in terms of cybersecurity. So I had a tool that overlaid and connected to every single one of our SaaS platforms. So it connected into our Google Workspace, it connected into, let's see just everything you think of, all the EMRs and all that. I could actually, certain EMRs that would let us, but I could find out, you know, if they're enforcing passwords, I could find out if they're enforcing, you know, single sign-on, if they got MFA, anything that you would almost want to need, you know, to know about the security and the setup of your cloud platform. So like when I'm going in there and I'm looking at it, I'm creating a new user. Well, I have it set up with our LDAP, or, you know, our enterprise authentication. So I'm going to use 1Pass or Okta, and I'm going to log into my cloud. And so that's one of the check marks is, do you have enterprise login in front? So rather than just the local username and login. So there's just a lot of different tools that are emerging to kind of help facilitate as everything goes into the cloud. You know, you want your data encrypted, and then you want to have somebody keep an eye on that information there. And then it goes back out into you know, one of the tools where your cybersecurity team reviews logs, things like that, so they can go in there and, you know, see if, let's say, the Google Workspace was not set up properly, or there was a problem there. You know, then we're alerted, we go talk to Mike, who's our Google admin, and he takes care of it. So that's kind of where you go with that data security. So our next scenario, software secure coding. Is anybody in here a web developer? No, cool. That's a terrible job. I'm just kidding. So in this scenario, we've got a web development team, and they're trying out a new open source web framework called Apache Struts. Their framework has a critical vulnerability that requires a patch, which is available for download. Unfortunately, the dev team did not proactively patch the vulnerability, and a group of hackers targeting the healthcare institution exploited the unpatched vulnerability, and basically they scrapped 300,000 patient records. So what in this scenario do you think the web development team should have done? And I'm going to assume some of you, not all of you, may have dealt like this with your IT department trying to install a new program on your computer. So if you want to think of it in that regard versus that, what would you do if you wanted to install a new application on your computer?
Should be scanned by security tools to make sure there's no vulnerabilities before. Like typically, like our workflow when we install a new application is cybersecurity will scan the server when it's provisioned, and then once all the apps are loaded and it's ready to go into production, we'll scan it again, do a vulnerability check, and then it goes on the routine scans list. So that way you're constantly watching it and it's not something that just slips through the cracks.
Yeah, that's a great active setup to do that. Another thing that you can do, you know, we'll look at the scenarios here. So obviously this first one, the multiple factors led up to the institution's largest data breach. The dev team, they use an open source framework. That's common. I mean, it happens every day. You just have to be diligent and keeping your stuff patched. The dev team did not go through proper channels outside of like the physical things that you're talking about and the things that they do scanning wise. There's a process in the back end generally that starts with procurement. When you're purchasing something or you're gonna wanna put a new piece of software into your environment, your security team will actually do a third-party risk assessment. And what that does is that works with the vendor of the software and the cybersecurity team, and basically they'll look at different documentation and they'll look at the software itself and they'll analyze it and basically give it a score and say, yes, this is approved for our network, the software's safe, no major vulnerabilities are out there, et cetera, and let it on the network. Or in this scenario, you know, well, we can let it on the network, but as soon as you install it, you have to patch it. And if you don't, then we're not putting it on. Or back to, you know, another kind of like a legacy. I mean, the legacy term can even go for software. If it can no longer be patched and you have something that's out there, Log4j is a great one that just keeps kicking the can and being a problem. It's just one of those pieces of software that cannot be updated, and it's a huge open vulnerability that's easily exploitable. So in this scenario, yeah, so the dev team didn't go through those proper channels, so the software was not within the asset inventory, wasn't being scanned, and never even showed up on the security team's software report. So the security team failed to detect the vulnerability because the software was not listed on the vulnerability management platform. And once again, you know, a lot of tools, you know, especially with like Microsoft or Mac, so you have Jamf or you have SCCM management platforms to basically enterprise manage your devices. So let's say you have 50 allowed applications. Most of you guys probably may not even realize this, but your hospital system or your system that you work for has a system that's probably scanning your machine, and when it finds a new piece of software that's not supposed to be there, it will remove it. If they're not, that's something that's easy to set up and it's there and they should do that. So thinking about it this way, doing the proper steps. So the dev team wanted to use their open source web framework. And obviously, like I stated before, it's common, but you gotta do your due diligence. So the dev team submitted the framework to the information security team for this third-party review. The review, like I said, it showed the vulnerability, so they'll patch it when they install it. And then the dev team installed the framework and everything was peachy keen and they did not lose any data. So really that just comes back to just making sure your stuff is updated. Granted, that is, I have to say that I am sometimes guilty, like adopting new hardware. So like when the iPhone 17 came out, I purchased a 16. And solely because I know Apple and their history, and generally that first time out, either there's a hardware issue, and don't get me wrong, I'm a huge Apple person. I have not owned an actual Windows computer in almost 30 years. So I'm a huge Apple fan in that regard, but I'm not an early adopter because, you know, sometimes those new things come out and they have problems. So keep your stuff patched, but obviously, you know, you want to make sure that the patches are good because occasionally you'll have a patch that also bricks. So a lot of times you'll have a patch that will be, you know, it'll have a, I just totally blanked on the term, but it'll have a signature on it that like states that it's been verified by the vendor and things like that. And so you just want to make sure that the patches are good and you're not going to brick your device when you update.
So I'm going to talk about policies, and this comes into play for kind of all of this. Without clear expectations for your organization and the people within your organization, you are at risk, right? Scott has, like, obviously you can tell, a lot more knowledge, right, in his head that he can get out in the time that we have with you all today. But that knowledge is backed up by years of experience. Without policies and procedures, though, and without following those guidelines, the workflow breaks down. So, for example, he just mentioned the web team, right? The web dev team. Think about it in context of if you have a policy that says, if we are going to apply a patch, an update that the manufacturer has recommended for a medical device or a system of medical devices, what process do we need to go through? Organizations that have good, strong policies and follow those policies, right, usually are preventing more of these weak links that we've kind of talked about. So for example, in that case where, say, manufacturer comes out and says, hey, we've got this magical update, we need you to put it on there, etc. I've seen this where, unfortunately, and I shouldn't say I've seen this, my team's done this. We've worked with the manufacturer, we've applied the patch, and then fortunately we were able to back out because it wasn't compatible with the existing infrastructure of the network that IT manages. If we had collaborated or worked together, and we did have policies that we should have followed, right? In this example that I'm not going to give you too much on, but it was with patient monitoring. If we had done that and followed our own policies, right? They were clearly written. We knew they were there, but we completely forgot because we weren't in that cadence of doing it every single time. And this wasn't a rush, right? There are some times when it's an emergency, you got to do something, and then you roll the dice, right? Or you might hit a whammy, or you might hit a big win, but policies help the organization stay on the same course. And they're also a good reference if somebody new comes into the organization or forgets, like me when I was a manager in this case that I brought up, this personal example. If somebody forgets, I really should have been accountable for that. My team knew about this too, but I should have foreseen that this was a big problem, big patient monitoring mistake. But fortunately, we were able to back out of it fairly quickly when we saw no patient data going to our central database. Let me make sure I've hit this. Of course, you want policies and procedures. Usually these are organizational policies and procedures about email, SMS, etc. One thing that's evolving is organizations are determining what's the acceptable use of AI, right? In that sense, one thing I will mention is make sure you know what the AI use is in your organization. And if it's gray area, default to the more extreme. And I'll give you this example about this presentation. Both Scott and I have used AI for some things, and I said to Scott, hey, we could gamify this, right? Truly make this like interactive game and show you all this, and it's pretty easy. If you haven't tried coding with AI, it's a lot easier than me doing it myself. I'm very, very basic. But we said, hey, ECRI just came out with a new updated AI acceptable use policy. And it does say, if we're not putting our data into it, ECRI's data or a client's data, we're probably fine. But going back to the gray area, we said, well, this is really called out or called in. Like, can we use Claude? That was the suggestion I had. Can we use Claude for this? And so we defaulted to, nope, let's just not do it. Now, we did run it up the flagpole with IT. This wasn't a priority for them to respond to. That's a whole other thing. We're not going to talk about sometimes response times, but it wasn't an emergency.
IT probably already brought up a sore spot. I can tell right there.
Yeah. As a matter of fact, I want to see some more answers. You want?
Yeah.
I'm throwing out Smarties. I got stickers for your laptops, your phones, whatever. So anyway.
Yeah, so we've been talking quite a bit, with you guys, but we want to hear, kind of back from you guys too. Just give a few stats, phishing emails, 90% of breaches start there, SMS, things like that, just kind of goes down. Ultimately, you just want to do your best practices, you want to be smart about everything you do. The SMS, I'll tell you a good example. So previous company that I worked for, we had some very high people up in the government that were very famous. So it was easy. People knew who we were. And so if you have your phone number on LinkedIn, it can be scraped. and then somebody texts you, and they're like, hey Scott, this is Farzad, I need you to give me 15 gift cards to, from Walgreens. I'm in a seminar right now and I'm going to be giving these out as rewards, but I don't have time to go get it. Can you do it for me? I can't talk. Thanks, Farzad. And so I don't know if you guys have ever seen anything like, but that's one of the most common smishing things out there is, they either, hey, are you free later? Or, hey, this is so-and-so from your company. It's the CEO and I need this now. It's an emergency, all the normal red flags. And so we had a barrage of attacks, like over 300 people in the company within less than like 30 minutes got text messages. And so we just started getting just influx of calls. Excuse me. And it ended up being that somebody had gone in and scraped everyone's phone numbers off of LinkedIn. And so we changed the policy in our company, for your profile, please don't put your phone number out there on LinkedIn. A lot of people still have it in your email, I guess we scrape from there. You just got to be smart about it. So that's kind of how a lot of that smishing and social engineering kind of drums up. Anything that you put out there on social media, people can take and twist it and talk to you. And with AI is a great example. So I don't know if anybody heard, like when ChatGPT really started getting out there, all the bad actors started using it as well. So all of a sudden, all the phishing emails with all the red flags are going away because now you don't have the misspellings, you don't have the weird, just the weird telltale things that say this is a fake email, because AI can make it look real. The scary part is they can make it sound like you. And one of my friends, their mom called them about 3 weeks after that big push, and like there was a big thing in cyber world where like bad actors were using ChatGPT, and his mother-in-law actually called his wife and said that she was in jail and she needed money right now. And it's like one of those, that's not cool. And so obviously she texted her husband, he called her mom because this didn't sound right, and she was at home. So then they knew it was fake, but it sounded exactly like her. They're able to produce your voice, and that's pretty scary. So if you have, YouTube, like podcasters or people that, you might have things out there that have your voice out there, that's just something to be aware of, not only in your business life, but in your, your personal life as well. And think about that. Anything that you do, your passwords, things like that, every WordCast password policies, use those in your daily life, because that will secure you just as much, because your personal information is just as important, if not more important, than your business information. So let's see. Yeah, so when we're looking at, just like some big wins, the big money, I like how Dustin kind of made some categories here, but like for authentication, multi-factor authentication, MFA, everyone's heard that. It's like having that dual layer to get in is just an easy way to just circumvent, the loss. You lose your password or someone compromises your password, that's a bummer, you can change it. But if you have MFA, they're still not getting in. Network segmentation, that comes back to legacy devices or just devices that are just need to be secured more than others. You segment it out, doesn't talk out, things like that. Staff training programs, that's a huge one. Your backup strategy, that's more on your IT, but it's, when you're talking about, business continuity, think about, and I won't say their name, but there was a big organization in 2024 that got a huge breach, which then shut down a lot of the prescription processing. Does anybody remember that one? That was a pretty big deal, and it affected people for weeks, even longer. But had they had a good backup strategy, everything that was encrypted, they could have backed it up within, 24, 48 hours. And so that was a huge lesson learned for them. And they won't happen again, hopefully. And then obviously, things to avoid, default passwords. Medical devices are getting better about it, but does everybody remember back in the day when you would get a device and inside the thing, the username was admin to get it set up, or admin and 1, 2, 3, 4. I mean, kind of like back to the 1, 2, 3, 4. It's like, if you have a default password or a default login, you want to disable it or change the passwords right away. Unpatched systems, we can just beat that into the ground, but always keep things patched where you can. Unsecured medical devices, IoT device broadcasting patient data in plain text. It's like there was no encryption, physically securing it, things like that. Just always want to keep those secure. And then making sure your staff is trained, kind of back to that very first slide. You know, your first line of defense, and honestly, your first line of weakness is the human factor. I mean, you can be as trained up as possible. I mean, I my last company, I was also our fisherman. So I was the guy that everyone hated because I pushed out the phishing emails. And I got our CISO, I got our CEO, I got our CIO, and I got our COO on this one. And it was because we were adopting Chat GPT. We had hired somebody that was like, oh, we're going to do everything AI. And I was like, hell you are. And so I threw it out there, and there you go. And I didn't get in trouble, but it was one of those, just let us know ahead of time. But it's just one of those things, like, they were trained, but at the same time, it's like they were so on the brain, kind of like just being distracted or being tired. It's like they just had AI on the brain. It's like, oh, I'm just going to go straight for it. And it worked like a charm. So yeah, making sure your staff is trained.
So you can hit some jackpots, so to speak. And again, we're using that pressure luck gamification. I am going to, though, because we haven't passed out enough of these, take a sticker or
yeah, we're
whatever.
getting close to time.
There's combinations. It's not always a one size fits all solution. First of all, MFA can't be done on a lot of medical devices right now. There are some manufacturers that are being pushed for that from their customers. So I would advocate for that, is ask, how do you secure your devices? How can I secure them in the future? What's the best practice? Work with your cybersecurity experts if it's in your team, or if it's on another department, division, whatever you call it. But ask, what's the future, right? What level of security do we need? So there are combinations. Let's say, for example, the triple crown, MFA, encryption, and training, right? Make sure that you hit all those pillars. That's the grand slam, so to speak. If you're familiar with pressure luck, if you're not, take a look at it. There's some great old stuff and some newer stuff out there. But hit those 4 pillars: the people, the policies. Those are the ones I talk about. They're the most important. No, and the software and the hardware, right? How do you secure everything from at least those 4 pillars, right? I can't think of a fifth pillar, but Scott probably can. You might be able to, it sounds like, but at least those main ones. And then we didn't really talk about this so much. Scott mentioned this a little bit, but doing a risk assessment of your vendors or their application. I will hit this and this kind of together. Having an incident response plan. What are you going to do when you do get attacked? Because it's going to happen, right? It's going to happen that you detect something, your cybersecurity team detects something on, hopefully not on a critical life-saving device, but it does happen that the network might go down and it impacts some critical monitoring device. What are you going to do? And then how are you going to continuously or do that testing, right? You can't really take everything down and say, oh, here's our test. You might have to do a tabletop exercise, right? Just like, how many here have worked for facilities at some point or worked with facilities in their healthcare system? Holy, well, okay. Well, facilities has to test under certain conditions. They have to test their fire response plans at night, on the weekends, different staff conditions, different areas of the hospital. And they have to demonstrate this to surveyors because they found that it was important not to just continuously do it at 7 a.m. in the morning, right? On Wednesday morning, because those staff, they hopefully got it at a certain point. When you're thinking about your incident response plans, think about the scenarios that are most likely to happen, right? Start small. And when you're testing, test them in a scenario that's likely to happen, but it could happen at the worst time when most of IT and most of biomed are really away, let's say Saturday and Sunday, and you only have limited staff that are on call, right? How would you waterfall or triage that situation? So
So I'm
Risk
going to breeze through this a little bit quicker. I know we're almost out of time, but so when you're doing your risk assessment process, or your cybersecurity team most likely will be doing it. But just know that if you're going to ever request, a software or a device or something like that, they should be going through this process behind the scenes. More than likely, if there's anything that feels like it takes a little bit of time from procurement, it's going to be because of something like this, because we're working with your vendor just to make sure everything's secure. So areas to assess your risk. So there are organizational risk assessment models out there. So like SOC 2, for example, which is their system and organizational controls. Basically, a third party will come in and review your organization. So you'll pick different, and they're called security controls, but essentially it's just all the little security components in there. Are you doing password protection? Are you encrypting, things like that? I'm just giving very high level. Do you have, a business continuity plan, things like that? So an organization would actually go through the third party attestation. And that SOC 2, once you have that SOC 2 report and it's done, it's good. I can take that report and read it and know if I trust that vendor. Because if they're back end, so they're hosting their solution in AWS. Did anybody get affected a couple weeks ago by anything AWS? Some DNS that might have happened? That's
Amazon,
yeah. And then the next week-
AWS, he's doing the
Yeah.
technical jargon. I did. I had a personal website,
Yeah.
or personal/professional website. It didn't really matter to me, but a lot of businesses were affected and weren't able to transact business even in the morning after things were resolved.
Mhm.
I didn't even realize things were down, other than I had Cloudflare and a couple other alerts come through and say something's wrong with your
Yeah.
domain.
Yeah.
But Amazon,
Yeah, because Amazon, they're SOC 2 attested and certified. So I've reviewed their, it comes out annually. And so I've reviewed it, probably almost every year for the last 5 or 6 years. The whole DNS thing, that was a screw up on their end. Somebody made a change without going through change control. And lo and behold, millions and millions of people were affected. So funny enough, that would have been on the SOC 2 and it would have said that they were meeting it, but at the same time, it's nothing is foolproof. One day somebody comes in, makes a mistake, it happens. High trust, that's the Health Information Trust Alliance, very similar. It is a little bit more in depth than the SOC 2, but both of them are solid, attestation, risk assessment reviews. And then obviously, reviewing your different third-party assessments. And what will happen is when you look at your different softwares that are in your organization, they'll also be classified. So like, if you're using Epic or your EMR, Athena, or whatever you're using, that's going to be, to me, a higher risk system. So it's going to get much more scrutinization and it's going to be reviewed annually. Let's say like you have Canva or something like that your marketing team uses to build their marketing materials. They're not putting anything sensitive in there, so that classification of that system is a little bit lower. Obviously, it's still a risk, but I'm going to review it every 2 years. So things like that, your department, your security team, more than likely, depending on the size of your organization, it's going to have some sub-functions, and one of them is called GRC, or Governance, Compliance, and Risk. And so most of the time, they'll be the ones that are working on these third-party things. So if your departments don't, or your security team doesn't have that, that's definitely something that your organization would want to look into in the future.
can I say something on this? So
Absolutely.
most of the time, biomed, in my experience, has kind of flown under the radar a little bit. Medical devices, and a good example from my experience was I thought, and there was no negative effect, but I thought our cloud-based CMMS provider had been reviewed by IT, until we started reporting to IT and they said, hey, you've got this CMMS. What is a CMMS? Which, don't get me started. They should have known that we had that, a ticketing system, basically. But they hadn't reviewed it, and I assumed it, right? I came into this organization, and they illustrated to me that it posed a potential risk because there's business information, right? Now, we didn't put PHI, don't put PHI in your CMMS, right? But there's business information like how much I'm paying on parts, what the POs are, who my vendors are, et cetera, in that same CMMS system out in the cloud. And once they started reviewing it, they started poking holes, right? too many to illustrate here, but they started poking holes in this vendor can't give us a good response about this. And that's just one example. That's your CMMS, kind of been device centric a little bit here, but your software, right? Make sure your vendors are meeting IT's standards, right? Or CEIT's standards. Sorry, I wanted to throw that in there. 'cause
Oh,
it
no,
was like-
that's great. That's a great example. I mean, that's just another one that to look at. So obviously, we're almost out of time, but we just want to hear from you guys. So like, what do you feel like your organization's doing right? Up on the screen, we've got just some common best practices out there, low hanging fruit that probably most everyone will have interacted with at some point in time. So is everybody, like when you're logging into your computer, do you have MFA? I assume most everyone's going to say yes. Does everybody get annual cybersecurity training? Is there anybody that does not?
Dan, I'm going to pick on you. Do you have annual cybersecurity training for your company?
Yes.
Okay.
Good deal.
Dan runs a very small company, but services a lot of different healthcare systems in his region.
One of our hospitals got hit
Oh,
a few months back.
okay.
And it turned out that one of the employees had gotten an email saying they had won something and they should click this link to get this product or whatever that they had won. And I thought, are people really that stupid? They think they get an email saying, oh, you won this product, you won, I mean, really?
You haven't worked with standard users, have you?
I know it wouldn't have been me because I don't win anything. I already proceeded with this,
Yeah,
but
I just thought.
I'd be hopeful.
I just thought, oh, you really think you won some prize and you have to, oh, you won the, what was the African lottery, whatever thing that was going around a few years back. I remember thinking, really? Are people falling for this? But they said they did. I guess, so the small hospital, they were doing a lot of this training, but somewhere an employee, when you say it's the people, yes, it's the people who click the whatever email and download whatever. I mean, I was kind of shocked at how easy that was to ransomware. But they, these systems that get ransomware, oh, you pay us this amount of money, $500,000, will restore all your patient information back onto your servers. And I thought, wow, what?
But it happens more than, and you
Oh, it happened.
you primarily serve rural and critical access facilities, right? Think of the vulnerabilities there. They don't have, my experience too, correct me if I'm wrong, is they have like one IT guy that does a bunch of stuff or two. So there's some concerns there, but let's move on. Yeah, that's great.
Yeah, that's great. And then, some of the things you guys may not even know that's there, but probably, I'm sure most of your organizations are encrypting your networks, encrypting your drives, things like that. And you more than likely does anybody ever get to be involved in like trying to purchase something? You have to go through procurement and they go through the whole risk assessment process. Have you ever been through that? Yeah, so it's everyone, most organizations, and I say most because you do run across ones that don't. I mean, kind of like the phishing click rate, it's still pretty high in 2025. So, just thinking about it, things that you may not know, and obviously this may be outside of your role in your organization, but if you do have a leadership position where you can help influence things, if you're not already, your organization should be, doing vulnerability scans on all devices on the network. Obviously incident response planning and business continuity, kind of like the tabletop exercises that Dustin was talking about. And then you have kind of a newer emerging technology that's kind of in the last couple of years. And there's a couple of vendors here today, this week that are in the IoMT, Internet of Medical Things, inventory and monitoring, some great solutions out there to kind of help your organization, not only just know what's on your network, they can also actually control some of the patching and things like that. Advanced threat detection, that's working with your phishing simulations and things like that. So basically, if you get a phishing email that comes in that's legit, systems like Palo Alto or different, email systems can actually go in there and rip that email out before it ever even hits your mailbox. So just doing a lot of proactive things is really where I get stuck, where I guess not stuck, but that's really where I take my stand, is like, be as proactive as you can, as an organization, a lot of these things are expensive. It's kind of like if you're going to replace an entire fleet of infusion devices that don't interact with the proper encryption protocol that they should, that's a pretty big redo, and I can tell you know what I'm talking about. So it's just one of those things, being as proactive as possible is just key, doing best practices. Like I said earlier, it's all these rules, they kind of touch, your personal life and your work life. If you got backups, you back up your personal stuff, back up your work stuff. Redundant systems, if your organization has the money, redundant networking, things like that, redundant ISPs, internet service providers, just helps keep things alive and going. The cloud multi-region, if you were an Amazon user and you got hit with the DNS thing, that was AWS West. So if you were paying for replication and you just spun up on AWS East, you were back in business and you would have never known. So that's really kind of what you're looking at there. Obviously the resilience planning is trying to determine how fast you can get back online. So, for the example earlier of the organization that got hit and it took down all the pharmacy stuff for a while, they did not recover very well. They did not restore well because they weren't prepared. So being as prepared as you can, back to the proactive, is really where it's at. Learning from other people's experiences, Change Healthcare 2024, Ascension Health, Common Spirit Health, all root causes of just common things: patched vulnerabilities, weak authentication, bad misconfigurations, social engineering. That's really it's really more common than you think. So just being prepared is key. Obviously, you can bridge between clinical and cyber. Medical device challenges, we talked a little bit about earlier: legacy devices with no security updates, network connected devices with no encryption. That's kind of back to the whole, keeping them physically safe. Killing the default passwords. And we wrote on critical equipment, but really that goes for everything. Don't leave default passwords or logins on anything if you don't want to have any sort of risk. And then obviously kind of back to, he had to walk out, but balancing security with patient safety. So kind of back to that USB. Do you need it right away? In a scenario like that, you could probably reach out to your IT person that's on call and they could come let you in if you needed to. I've actually had that scenario happen. We locked everything down, somebody needed something, so we just ran over and unlocked it. So that's definitely something to be out there. For HTM best practices, Dustin, you want to go over these few items?
Yeah, I do. So I've been challenged with this several times, is working with IT, HTM, and the supply chain. But your best practices are to do these things collaboratively, just like you would in the procurement process. Maybe if you're an HTM professional, you're a technical advisor to the clinicians to say, whoa, the salesperson told you this, right? But it's also a check and balance when it comes to security, right? It's a matter of getting, my experience is it's a matter of getting supply chain to understand that you can take a little bit of time, right? In most cases, you can take that time that's required to properly figure out how you're going to implement the system, right? And I say that because you may be limited to 2 or 3, or maybe it's 7 different major vendors of a particular product. Or in the case of surgical robots, the landscape's pretty dry, right? But working with IT and in procurement to come up with a solution before it hits the and the surgical robot example is a really good one. Before it hits the dock, the engineer's there, they're setting it up, and 2 or 3 days later, the hospital intends to show it off to the press or the media, right? And then they start doing surgeries. Security is important right there. Be proactive, right? Inventory and risk classification, we mentioned the IOMT systems out there. Those make your life a lot easier, right? Honestly, a lot easier, from collecting an inventory of certain things like IP addresses, MAC addresses, right? Sniffing out those devices. These are passive systems that I will talk about, not. Vendor security partnerships, already mentioned this, but make sure your vendors meet your standards, right? And vendors, if you're not aware of what those standards are. Work with your clients right now, your customers right now, and find out, because they're probably doing about the same thing as the hospital down the street. Patch management and clinical coordination, I will mention this. This is a little bit harder than OS updates to Windows laptops, right? But be just as cognizant that you need to get on the cadence as you would with, say, preventative maintenance, evaluating your maintenance plans and strategies, forecasting, et cetera. But now you've got to layer in this with more and more connectable devices, not just connected devices, and saying, what's the risk if I don't patch this tomorrow, right? You don't have to run out and do most of these tomorrow, but how do I identify how to get this information? This is one of the biggest problems, I think, in HTM right now, is going to everybody's portal and finding out if there's a new update patch or what patches are available through, say, Windows, and which patches have not been validated by the manufacturer. One thing on this is, if you're in an emergency situation, say you get hit by and hopefully we don't, but it's going to happen again, I'm sure, and again, we get hit by a WannaCry, Conficker, or something like this. The FDA has acknowledged that you can take on that risk if you're the healthcare organization, and you can say, well, you know what, I'm going to see what it does, right? But it also has the risk of breaking the system and then having the manufacturer say, you should have waited for us for 3 weeks. Sometimes you need to make some operational risk assessments. And the last is do this. Report the incidents, right? Report these incidents to the FDA, right? To ECRI. We have a reporting system as well. We actually usually say report it to both of us, right? But report it at least to the FDA if you've seen a cybersecurity vulnerability or risk, and to ISC CERT, right? They're probably more cognizant of these things than the FDA honestly is. But best practice is make sure you're on top of it when you can. And going back to the continuity practice, whoops, sorry, business continuity and incident reporting, make sure that, or not incident reporting, but the tabletop exercises, make sure that you're walking through the paces with your staff and saying, what would we do in this situation, or how do our systems work? Being that I've been around in HTM for a while, I know I've been a lot more reactive initially to these things than I felt like should, but I was called up and saying, hey, power's completely out in the hospital. How long will the ventilators run? That should not have been just me that knew that, but we had battery backups on the ventilators and for the compressors on them, and I could talk through it, right? The organization needs to know that. Incident command or that incident command center that's set up needs to know what's going on in case I'm dealing with something else, right? Natural disaster occurs. I'm old school. I was told you'll go into the hospital, but I've also am old school enough to say, even before I had a family, but what if my family needs me too, right? I'm not suggesting being selfish, and I'm not suggesting not being selfless, right? But keep those things in mind. Here's some resources that we're going to give you, and the link, the presentation will be available for in a week, I think, from what MD Publishing has told us.
So yeah, definitely just we appreciate your time today, going over security posture. Definitely, sorry I went over just a little bit, but I hope everybody kind of learned something today that maybe you didn't know, or just hoping maybe some ideas that your institutional organization might be able to implement if they're not already. Definitely, we are always going to be around here for you. There's both of our emails, so if you have any other questions or anything like that, please definitely feel free to reach out to us. We'd love to talk more. So.
And sorry, I'm going to go back one slide here. You need to reach out to us for some of these, right? Most of the materials are embedded in the presentation, and that will be out in about a week or so that people that couldn't attend the MD Expo or didn't attend this session can glean some of those things, the notes, the links, etc. But reach out to Scott and I if you want some more in depth, like a security self-assessment. It'll be high level, right? We can talk about what that looks like if you want to get into more detail. Scott will talk to you about that. But it'll be high level kind of self-assessment about where you are as a department and as an organization. Again, more on the HTM centric basis, medical device security, but it will talk a little bit about the big picture too. Thanks.
Yeah,